What is social anxiety disorder? Social anxiety disorder, also known as social phobia, is a type of anxiety disorder characterized by excessive fear, anxiety, discomfort in social settings. While it is normal for people to feel anxious in some social settings, individuals with social anxiety disorder, social phobia, have a heightened fear of interaction with outer in a variety of social interactions and worry they will be scrutinized by others. This intense anxiety causes impairment in functioning and interferes significantly with the individual's life and relationships. People with social anxiety typically know that their anxiety is irrational, is not based on fact, and does not make rational sense. Nevertheless, thoughts and feelings of anxiety persist and are chronic in nature. Common triggers. People with social anxiety commonly experience significant worry and distress in the following situation: eating in front of other people, speaking in public, being the center of attention, talking to strangers, going on dates, meeting new people, interviewing for a new job, going to work or school, meeting other people's eyes, making phone calls in public, using public restrooms. Symptomatic. An individual may experience physical, emotional, and behavioral symptoms of social anxiety disorder. The symptoms can significantly affect the individual's daily life and relationships. Physical symptoms: rapid heartbeat, dizziness, muscular tension or twitches, stomach trouble, blushing, trembling, excessive sweating, dry throat and mouth. Emotional symptoms: high level of anxiety and fear, nervousness, panic attacks, negative emotional cycles, dystrophia concerning part of their body, most commonly the face. Behavioral symptoms: avoiding situations where the individual thinks they may be the center of attention, refraining from certain activities because of fear of embarrassment, becoming isolated. The individual may quit their job or drop out of school, excessive drinking or substance abuse. Causes and risk factors: the exact cause of social anxiety disorder, social phobia, is unknown. However, current research suggests it may be caused by a combination of environmental factors and genetics. While there is no causal relationship between childhood motorment or other early onset psychological adversity and the development of social anxiety disorder, they can be considered risk factors. Individuals prone to behavioral inhibition and fear of judgment are also predisposed to social anxiety disorder. Genetics may also play a role in the development of social anxiety, and these behavioral traits are strongly genetically influenced. What's more, social anxiety disorder is a heritable condition. First degree relatives have a 2 to 6 times greater chance of having social anxiety disorder. Treatment option: social anxiety disorder is a fully treatable condition that can be overcome with effective therapy. Communicant and patient. We recommend location a specialist in your area to find a treatment pathway that works best for you. Some treatment options your doctor may choose include Cognitive behavioral therapy. A huge body of research had shown cognitive behavioral therapy to be a remarkably successful treatment for those suffering with social anxiety disorder, social phobia. The American Psychological Association defines cognitive behavioral therapy as a system of treatment involving a focus of thinking and its influence on both behavior and feelings. CBT emphasizes the role of unhelpful beliefs and their influence on emotional and behavioral outcomes. Social anxiety specific CBT focuses on changing the individual thoughts, beliefs, feelings, and behaviors and as they relate to social situations. The cognitive part of the therapy refers to thinking and is a part of therapy that can be taught to the person. The act of practicing new tools, choosing repetition when the individual notes unhelpful tools allows new patterns of thinking to become automatic. People with social anxiety disorder may also try various relaxation methods to relieve the symptoms of anxiety. Examples of techniques that have been shown to be helpful include massage, meditation, mindfulness, hypnotherapy, and acupuncture. However, the methods do not help people fully recover from social anxiety. Only CBT can help those struggling make permanent progress against social anxiety by changing irrational thinking into rational thinking and helpful to induce habitual and appropriate behavioral responses. Medication. Medication is a useful form of treatment for many, but not all people with social anxiety disorder, social phobia. Research suggests that the use of anti-anxiety medications such as benzodiazepines and certain selective serotonin reuptake inhibitors CCRLS used in conjunction with CBT have been most beneficial. Only CBT can permanently change the neural pathway association in the brain and therefore medication alone has no long-term benefits for people with social anxiety. Thank you for attention.